Hi and welcome to the back page, the Ashgrove Spinal Centre's weekly newsletter. You're watching this via YouTube, so please remember to click like because that helps other people find this post. Click subscribe because that helps you to find this post, remembering to click the notification bell. But most importantly, keep those excellent questions and comments coming in the comments section because that allows us to guide the content towards content that you want to hear. Thank you. Hi, and welcome to this week's back page. It's the 24th of April, which means that tomorrow will be the Anzac Day public holiday. I just wanted to acknowledge all of those who have previously served our nation, those who continue to serve our nation, and remind everybody that for many veterans, service doesn't end when they return home. Anzac Day can be a very emotional day, and therefore, if you see our veterans out and about in Ashgrove, they're very visible. Say g'day. If you get the chance, shout them a beer, and perhaps if you get an opportunity, just listen to them talk. It's a small gesture, but it's a massive gesture for those who have given so much, so consistently over such a long period of time. But now onto the topic of today's video. What does non-specific low back pain even mean? Well, non-specific spinal pain is one of the most common reasons people seek the opinions of chiropractors. Specifically, non-specific back pain, neck pain that is of a biomechanical nature, which means that the biomechanics or the normal movement of your neck or low back or spine is just not working the way it should do. This can often produce symptoms such as dull pain, can produce catching pain, can produce discomfort, feeling of weakness on certain movements, or most commonly people feel a reduction of their range of motion. Okay, so they can't turn their head quite far enough in a certain direction, they can't bend comfortably in a certain direction without pain or maybe discomfort, or even just a feeling of vulnerability. So what's happening and why does spinal manipulation seem to help so much? Well, you've probably seen me explain this in the practice. This is an oversimplification of the biomechanics of the human spine, but for the purpose of this conversation, it's perfectly appropriate. You can see that under normal circumstances, all the spinal joints move and produce the movement that we enjoy. But sometimes certain segments get stuck and don't move, and you can see what's happening there. These segments in the middle, they're just not really enthusiastic about moving. There's a range of reasons why this can happen. In the case of biomechanical, non-specific biomechanical back pain, it's generally because they have, for whatever reason, progressively seized up. Usually that will just start with it could be because of a previous episode of pain where you have reduced your range of motion or the body has changed the way it moves to avoid pain, and then it's retained that pain, that movement strategy even after the pain subsides. It could also just be through wear and tear, or maybe just a bad habit that you've fallen into without pain. That could be the result of workplace ergonomics or particular exercise or activities that we engage in, or maybe even just habits that we could have had for quite a long time. You'll notice, using the model, that next to the areas that are stiff, there's usually a segment that is overcompensating to balance the movement out. These are often joints that we might identify as being hypermobile, and they can often be the ones that catch or pinch during movement. And some people, not all non-specific biomechanical back pain is actually low grade. Sometimes it can be quite catchy. And many of you will experience that. Certainly most of the patients I've seen have some level of this. So why does that come about? It could be because of an old injury. It could be because of activities that you do and the ergonomics that place particular load on certain parts of your spine, and it's unable to complete those, so it slowly breaks down. There is, and this is covered in more detail in another presentation, when the body heals, the body tends to heal stiff, and then it leaves our normal movement to get rid of that stiffness and remodel the tissue according to what we need it to do. Now, the problem with this is either through wear and tear of poor ergonomics, poor posture, or even good ergonomics, but too much of it, and perhaps even injuries as well, we can end up, for lack of a better word, rusting into a certain position. So consequently, people use all sorts of analogies when they're talking about spinal adjustments, from oiling the sticky hinges, so that's oiling these ones that don't want to move as much as what they should, all the way through to knocking the dust out of it and what have you. But one thing that is fairly uniform is most people, when they seek a chiropractor and they have non-specific low back pain, or even just non-specific biomechanical dysfunction, which means certain segments of their spine aren't moving as well as what they should, they find relief or feel improvement from getting an adjustment. So in terms of things that you can do at home to determine whether or not, well, look, if you've got non-specific low back pain, neck pain, you're going to know because, well, you've got pain. What you can do before that is you can actually do little screens yourself. Very often people will come in and they will report something. So they'll say, oh, look, I know that it's time to come in and get an adjustment because when I reverse out of my driveway, I have to look over my shoulder to make sure that I can reverse out safely. And when I do that, I find that I just can't get very far. And what that's an example of is they've just progressively tightened up to the point where they notice it and they can't actually turn their head. Sometimes what will happen is people jam up, and they get to the point where they don't have their normal range, or they don't have the normal movement. They can't do the things they normally do, and what they'll end up with is tissue damage. So they overdo something, and then they end up with inflammation and pain. But in these cases, it would be possible to intercept that process, avoid the pain by addressing the biomechanics before they become an issue. In some respects, this is actually the essence of monthly maintenance, or management is the term that I prefer to use, visits, whereby people come along on a certain time frame and just get a tune-up. They just get the sticky hinges oiled. But other people, that may not suit them for all sorts of different reasons. So in the neck, for example, a simple thing that you can do every morning, you can do it on a certain day of the morning, you can even do it on a certain day of the month if you wanted to. But you just do a simple range of motion. So standing in front of the mirror, if you've just done your hair, if you've just shaved, turn to your left and come straight ahead, turn to the right. You can also put your ear on your shoulder. Notice we're not applying any extra load, and you can do that on both sides. And you can also get a little fancy, but you need to be careful because balance can be an issue if your balance isn't really good, where you look up, turn your head to one side, and then put your ear on that shoulder. So that's a combination of different movements. You probably had me do this test on you in the practice. The reason why that's a good test is because it puts quite a lot of load on what are called the facet joints, which are a joint that's really involved in generating pain in the neck. Similarly, you can do something similar in the lumbar spine, which is locking your knees, bending forward, trying not to bend as much with the hips, but making sure you're bending with your spine. So bending forward, touch your toes. Bending over backwards is often a big one. You can put your hand on the outside of your leg and slide it down, so you'll tilt over sideways. Do that on left or right. Or you can actually put your hand on the back of your leg and slide it down, so you'll also bend backwards and turn sideways, and it will even rotate a tiny bit as well. Essentially what you're doing is provocating the spine to see how well it's moving, and if it's uncomfortable, stiff, catchy, or you experience pain, well, maybe it's time to come in and see us at the practice for a bit of a tune-up. I'll work further on these videos and this concept based on feedback, so please keep those excellent comments coming, and hopefully tailor this to deliver the message in a fashion that's going to be really suited to you, the viewer. But otherwise, have a great public holiday. Remember to show those veterans some love if you can, and I'll look forward to seeing you soon.